informatics research nurse at Parkview Research Center. And a lot of people say, oh, great, well, now what's that? So I use my nursing skills to apply to research that involves technology. So that's kind of my position. Today I'm going to tell you about a study that we are currently doing that involves technology and mental health in adolescents and young adults. And then I want to show you some examples of all the things that I'm going to talk about. So some specific examples of how technology could help youth with their mental health. I want to start by taking just a few minutes to tell you a little bit about my journey to get to this point. I have battled with depression and anxiety. I'm not exactly sure how long. I would guess that it started in my late teens, early 20s, and I have battled with it ever since. I've also had family members who have struggled with their mental health, including a niece who was once suicidal at the age of 13, I believe she was at the time. I went to nursing school here at IPFW. I just graduated a few years ago in 2013, and there was a significant event that happened that helped guide me toward this research. In our senior year, we are required to do a quality improvement project, and I did mine. The topic was math anxiety and how to help nurses learn those math skills that they need to safely do medication dosage. But as a side part, like I needed a filler for my paper, my big paper that I had to turn in at the end of the semester. So as a filler, I decided to go in front of these beginning nursing students, the classroom portion, and ask them what their stressors are. So I was asking them things like stressors between people and within themselves and outside of themselves. And I had them anonymously write those things down and hand them in to me. And one of the anonymous pieces of paper that I got said that that particular person had a risk for suicide. So I had, collected all these papers at the end class, stuffed them in my book bag. It's like 9:30 at night when I finally get them out to look at them, and I read that. And my heart just sunk into my stomach because I felt like somebody was crying out for help, and yet I didn't know who it was. I didn't know what to do. Got my professor on the phone and my preceptor and addressed it from there. But that was something that happened in nursing school that guided me to this research. I've also, through social media, recognized a need for technology to be able to help with mental health needs of youth, and I'll show you some examples of that in a little bit. And now being an informatics research nurse, I found myself in a position that I can learn how to help people. There's a greater need for this research because Indiana has been found to have a big problem with youth who are suicidal. There are surveys that go out into the schools for them to learn this, and the Indiana Youth Institute says we have the highest rate of teens who have considered suicide and the second highest rate of teens who have attempted. And that was staggering to me, and it hit home when I learned that at the time my only son was in his late teens. And it just kind of like that experience at nursing school, it made my heart hurt. The Youth Risk Behavior Survey has been put on by the CDC for over 30 years, I believe, and they ask some very specific questions related to mental health, including the following. I think it's pretty staggering to see some of these statistics. And these were from 2015, the students, high school students surveyed in Indiana. So a very large percentage had had signs of depression. 19.8 seriously considered suicide. 17% had gone so far to make a plan, which is in mental health care, it's kind of an increased sign that they're at risk for dying by suicide. I've also learned that the Lutheran Foundation funded a community mental health needs assessment a few years ago. And they found many of the same barriers to accessing care that's been shown in the literature. So things like stigma and cost and a lack of information and how long it takes to get into a provider and sticking with the therapy. One of the things that really stood out to me in their work, they did focus groups and surveys. And something that really stood out to me were comments made by school administration and parents. So the schools are really scared to have to deal with suicide at all. They don't know what to do about it. And parents put faith in the schools to be able to do something and recognize that because they themselves don't know what to do if their son or daughter is dealing with a mental health problem and they don't know where to go for help. Wanted to share a few fun statistics with you just about youth and their use of technology. These are from the Pew Institute. And as you can probably guess, a large percentage of teens have access to a smartphone. Their preferred communication between each other is texting. They're going online daily, instant messaging their friends. And they've also looked online for information about stress or anxiety, depression, and other mental health issues. Majority of friends spend a lot of time on social media, but one significant thing that I wanted to point out is that 68% of teens said that they've received some sort of support for a problem that they were going through or challenging times. And 57% have met a new friend online, but only 20% have ever met that online friend in person. So I wanted to, some of those things I was talking about that made me want to do this research more are some of the things that I'm seeing on social media. And there are youth who are posting things on social media sites related to the problems that they're having, their mental health, their struggles. They're already using social media to do this. These were just some searches. Hashtag depression sucks, pulled up some comments of what people are going through, the lows, and when they get past the lows and looking back on them. Posting quotes, things like that. Over here on the right is a screenshot from Instagram with the hashtag #WantToDie. And there are a lot of posts, some of them shocking. There are people who are posting videos on Instagram of them cutting themselves and things like that. And people are using hashtags to express their feelings and struggles on social media. Check out hashtag suicide. Over 5.5 million public posts. So that's not even counting any of the private posts. And now social media sites are taking action to try and help people who are exhibiting some of these behaviors on social media. When I typed in, I believe it was hashtag suicide into my search, this box popped up. So it's their way of saying, hey, we recognize you may need help. Do you want help? And if you click on this link, it actually takes you to a Facebook page that gives you different reasons and suggestions on how to get help. And when you press on that contact a helpline, they have a phone number that you can call or a number that you can text for help. So one of the things that I wanted to find out was if telemental health could be the missing piece to this. So before I go any further, I want to tell you how we define telemental health, because in the literature there is a wide variety of definitions, and there's not a consensus of opinion on what telemental health really is. We based our definition off of the definition of telehealth by the HRS, and we define it as the use of technology to deliver mental health care, information, and education from a distance. So we're looking at all sorts of different technologies, not just those that are now being used in traditional mental health care, but also some of those ways that teens are already using the technology and then trying to apply that to the telemental health options. So we're looking at websites and social media and apps and different ways that teens reach out to each other, like texting and online chat and video chat. So we know that youth use technology, and we know that many are struggling. A lot of times, not just youth, but adults too, we don't get the mental health help that we need. We try and figure it out ourselves or numb ourselves by self-medicating and things like that. So we put together a study which is funded by the Robert Wood Johnson Foundation, and it's called The Perceptions of Telemental Health Among Adolescents and Young Adults, and it's an 18-month study which will conclude in March of next year. So our goal is this is our overarching goal, but we want to help improve access to mental health care for those who need it, and hopefully finding out what youth's perceptions are of these telemental health technologies. Our aims of this study are complex. So we want to find out how youth make decisions about how they get mental health care, when they do, how they do, their perceptions of these different telemental health technologies that we'll go over, what makes up a high quality, high value experience when using telehealth, and throughout we want to try and figure out what the health system's role might be in all this. You know, does Parkview have a place in providing telemental health options? So as I said, it's an 18-month study. We've broken this study into 3 parts, which are culminating into that survey study in the last phase. So in phase 1, we used the Delphi method. Is anybody here familiar with that? Okay. So the Delphi method is a way to reach a consensus of opinions. And the way that we did it was we devised an online survey that we sent out to a group of experts. And I'll tell you who those experts were in just a moment. And we sent out the first survey, they responded, and we did immediate analysis within a week to gather what they said and turn it into another survey based on what they said in the last one. And then we did that one more time, so 3 rounds of surveys. Then we did focus groups, which we did a total of 7 focus groups. I'll tell you a little bit more about. And then the youth survey is to really get at what their preferences are for these technologies. Would they even use them? And we're going to be surveying a general population of youth 14 to 24. So in that phase 1, we targeted 5 categories of experts. We had mental health clinicians and those who work in mental health organizations, mental health resources, educators, and parents who experienced depression or suicidal ideation themselves as a teenager, or parents of adolescents with the lived experience, and then who had lived experience themselves, so they experienced those problems as a teen. I'm just going to go over a few of the results from that, but what we did was we pulled out some of those main barriers from the literature and from the Lutheran Foundation survey, and we asked them how big of a problem they thought it was, and they all agreed that these were barriers that prevent youth from accessing mental health care. But at the same time, they also said that these barriers can be overcome by telemental health options. I want to point out an important part of the study. We generally described telemental health, and we did not give them any specific examples of what we meant by that. We asked that group of experts who's responsible to ensure students get the mental health help that they need. We asked it separately from high school students and college students. So parents and family members were at the top of the list for both. So these experts thought that this group was most responsible to help students get help if they needed it. Online community being last. Anybody have any opinions about this list? Do we have any? Yes, please.
I would have thought that your friends or peers would have been higher up.
Me too.
Or at least a few of your friends.
Don't you think that friends can pick up on some things faster than parents and family members? Yes, please.
Well, especially in high school, your friends and peers are often in the same boat as you, so they're not really necessarily in a position to help. So.
That's true. Yes.
I was just thinking that perhaps the word responsible in the question might be influencing the ranking there.
Absolutely.
Yeah.
I was still kind of surprised by that friends, though, because as a parent, I would hope that if my son or one of my loved ones posted something alarming on social media, I hope, if I didn't see it, I would hope that their friends would say something or reach out to me. Yes, please.
Well, two things struck me. I noticed before that stigma was a big aspect of why they don't find themselves comfortable to reach out. And a lot of that stigma is actually part of the peer group dynamics. So that, I think, is a big part of what we're seeing in my personal assessment.
Yep.
But in addition to that, young people don't have a lot of experience understanding how to respond to these cases. And if we don't show them with different sorts of teaching methods how they can respond to their peers, I don't even understand if we have the ability at that age to respond in a way that would be successful. So that might be something else that they're fighting.
Very good point. There are some organizations that are doing peer-to-peer training so that students are able to help other students in that way. I don't know of any at the high school level now. I believe that I know of at least one here at IPFW. Are you a part of that?
Just Project Compass, right?
Yeah.
There was an interesting thing Carnegie Mellon had done with regards to sexual assault, and I don't know if it's going to be similar with something that they could do on the same vein, where they made a video game, an interactive comic strip for young people to just experience certain situations, have optional choices that they can make to benefit their friend or not benefit them, and see how that would play out.
Right.
Which I think would be something that would be non-invasive, and it's much easier to have the ability to go back and do things differently, to then learn from it and not feel, I guess, not to judge yourself as youth and how they address each other.
My question on something like that is how proactive would a general population be to use a tool like that?
It has
Right.
to be the educational system.
And one thing that we heard multiple times in the different focus groups in the next phase from this one was that well, I'll get to that in a little bit when I describe that. We'll go back to that. We also asked them, to what extent do youth trust each of these groups of individuals to help them get mental health care? Any guesses on what the top 3 were? Nope, not in the top 3. Online Friends was one.
Internet search engine?
Yes, that actually came up first. Here was the third one, friends and peers. So this kind of goes right along with that previous slide of responsibility in my mind. So parents parents and family members are responsible according to this group of experts, and yet this age group trusts their friends and a search engine and their online friends more. Makes it tough. Yes?
When you say online friends, what exactly do you mean by that? Like, is that exclusively the people that they've only met online?
Well, that's something that we did not define for this group, for this survey. We left it open. Now, to us, that means people that they communicate with online, but they don't know in real life. So people that they're friends with in real life, but they communicate with online, we put that still in the friends and peers. But for this purpose, we didn't define that. You have something else to add?
I don't have my hand
Okay. They found benefits in telemental health, but they also found concerns. So they said it would definitely help to improve access to mental health care. It's convenient and youth are familiar with the technology. And one thing that was kind of a split was this may be easier to open up via technology versus face-to-face. My kind of unofficial hypotheses before this went on was yeah, youth are able to open up easier versus technology. I see it all the time, right? There were also lots of concerns like lack of privacy, problems with the technology, stigma, costs, and the biggest one that came up over and over was that technology cannot be a replacement for traditional mental health care.
What are your thoughts on that last bit there, saying that it's easier to open up via technology? I guess I keep wondering, why do people think that that's better than actually trying to get a connection between?
Not better, just different. Because some people have a hang-up about talking to somebody about their stress and their struggles face-to-face, they sometimes find comfort in that layer that technology provides between them and that other person, but not all.
But wouldn't it get them more catharsis in the end?
Possibly, but it would depend on the type of help that they're getting. And I'll show you some examples of what I mean by that. Yes?
Did you take into consideration the use of avatars?
We did not go into that. Mm-mm. So I think I touched on this briefly, but basically they are saying that face-to-face with a mental health professional is better. It should be the number one gold standard. This is what we want to push people to. But at the same time, they had concerns and saw a lot of good in the technology. And by the third round, remember I said these built on one another. By the third round, we had them saying, yes, traditional mental health care is better, but especially for those people who wouldn't otherwise get mental health care, it's great. and hopefully they would use it to get into traditional mental health care, according to our experts. Phase 2 was focus groups, and we had 4 categories, 7 total groups. So we had clinicians and educators in one group, parents of youth from 14 to 24, and then we separated out the youth in groups from 14 to 18 and 19 to 24. Now, in this phase, we went deeper into describing and actually showing them different technologies. So that's what I'd like to do here today, so that you have a better idea in mind on what some of these capabilities of the technology are. So, as in the Delphi study in phase 1, we were looking at these categories of the technologies, but then we went even further and divided them into those that are provided by licensed mental health professionals, those that are provided by those that are specially trained to help, self-help options, and peer-to-peer. And then we also talked about when it's appropriate to use or recommend these technologies to youth. Is it everyday, day-to-day problems? Is it for ongoing problems that are chronic? Or is it just in moments of crisis? And just to let you know, a lot of these examples that I'm going to show you overlap with one another. There are some that offer multiple features. I'm going to show you one example of a app and website that is provided by licensed mental health professionals. So these are people that follow a code of ethics. They keep all your information confidential and secure, and there is a fee involved, but they explain that all up front. So this would be like an alternative or supplement to face-to-face in-person therapy. Talkspace.com has therapists, over 300 professional therapists that can be contacted 24/7 via text, video, or voice messaging. So the users can reach out for help whenever they want. It's secure and private, protected. And one of the things that's unique about this compared to face-to-face therapy is that they can look back on the history of the messages and see where they've come from and if they've gotten better. Some examples of these options by people specially trained to help. Now, these are not licensed mental health professionals. Yes, please.
With the last, does the patient get to choose between text, video, or voice? Or
Yes.
is it chosen for them? Or they
Get to
do the
choose.
option?
Yep. There's another example of this that I came across, which I'm going to include in our examples for the 3rd phase of our study, that is called BetterHelp.com. And this one, it's an asynchronous back and forth. So you send a message to the therapist, but then you have to wait for them to respond. With BetterHelp, you can schedule an online session with the therapist. So you get in real time advice and guidance. And they can do that with video chat or online messaging or a phone call, I believe. So these resources by people especially trained to help, they're on demand. So the person has to reach out to them. It's usually anonymous and free. 7 Cups of Tea is one example of this type of technology. So this is a website and app that has thousands of users on it that are waiting to talk. So if you need support, assistance, advice, then you go on here and it connects people to real listeners in one-on-one chat. These are trained active listeners. They've been trained in a technique called active listening. And One important thing about this is that it is anonymous, so users don't have to say who they are, and membership is free. Crisis Text Line is another one. Has anybody heard of this resource? This is a kind of an alternative to, anybody remember the switchboard hotline from years ago in Fort Wayne? You can, it's like a hotline. So if you are in crisis and don't know what to do, you could pick up the phone and call this number. This is the new age version of that. So people in crisis can text a keyword to this number, and they'll be connected with a live trained crisis counselor. And they are trained to help people stay calm and stay safe, and it is anonymous. Peer-to-peer resources. So these examples connect people who are struggling with the same things or have the same type of experiences. It can be anonymous. So Talk Life is one of these. So one of the things I was looking at with this was, okay, what's the difference between something like this, which is a peer-to-peer social network, but specific to those who are struggling? What's the difference between that and some of those other social media sites that they're using? So you can anonymously, or put your name to it, post things and get support from other people that are going through the same thing. OkToTalk.org is another example of this. I equate it to Tumblr, kind of. And it's a community for people struggling with mental health problems, so they can post how they feel and get support to one another. But this one can use creative content like photos and videos and song lyrics and things like that. This is moderated, so that's a difference from the traditional social media sites. So they have moderators that are looking out for bullying, evidence that you are at high risk for suicide, and things like that. Some self-help options that we looked at are just for individual use. So you'd have to go out and find these and to be able to use them. But there are a ton of apps related to mental health right now, and a lot of them based on self-help. This is a website, nowmattersnow.org, and they actually teach users specific skills in a type of evidence-based therapy. But they have to go to this website, click on these different things, and it walks them through videos. The videos instruct them how to do these things. They show videos of people who have used the skills. Virtual Hope Box is an app that was actually, this is used by the Veterans Administration with veterans who are working with a mental health care provider. And it was designed for people to start to use it with the guidance of their therapist, but then be able to have it as a tool that they take away from the office and are able to use at any time. It has some things like some instruction on ways to relieve anxiety and stress, like controlled breathing, muscle relaxation, guided meditation. Has a distract me button, so you can go and play a game to distract you if that's what you need at the time. And these coping cards are something that the therapist helps them incorporate what's healthy for them to help cope. Things like pictures of loved ones, songs, videos, things like that. Here's another app. Now this is one for people who are at risk of suicide. It's called My3 Support Network, and it allows people to personalize this app so that they can use it if and when they get in that moment of crisis. So they put in 3 phone numbers. Who are the top people that you can call for help if you need it? And it creates buttons so that you can call them very quickly or call 911 if you're at that point. It does incorporate a safety plan, which is an evidence-based way of helping people who are at risk of suicide, and also provides resources for national suicide prevention resources. So overall, we are actually, we've only done preliminary analysis on the focus groups, but I can give you a pretty good idea since I was able to moderate most of them. So there were very mixed reviews. I'd like to kind of focus on what those youth were saying in the focus groups. It was very interesting. We held the college age groups first. We did 2 of those. And a lot of them were very open about talking about their own experiences and if they really thought that they would use some of these technologies. A lot of them were situational. So like the crisis text line and the My3 support app for people at risk for suicide, they weren't themselves at risk for suicide, so they had a hard time seeing how that would be useful. And yet they, for each of them, they all said, yeah, I think that's a good resource for other people, just maybe not me. There was one of the most surprising things that we learned in the focus groups, and this is something that I wanted to explore from the Delphi results, is that youth said that they want to talk to somebody face to face, or they at least want to see the person's face if they go to somebody to talk about their problems and their stress. So that kind of answered the question on, do youth prefer to use technology versus having an open face-to-face conversation? So I wasn't expecting so many to say that, but because we went through different ways that people communicate with their friends and their parents, and they told me all the things that they like and they don't like. Like one of the big examples was in communicating with their parents, they'd rather just call them on the phone because parents apparently take too long to answer text messages and things like that. But a lot of them wanted to talk to somebody face to face. We asked them who they would go to, and it was all over the board. There were family members, but not everybody has supportive family members who would understand and give advice without judgment. And so those were some of the interesting things from the focus groups. It was interesting with the educators and clinicians because a majority of them were not familiar with any of these technologies themselves. And we had people writing them down and saying that they were going to tell their students about these different things. So that was kind of satisfying to hear. In the parent groups, a lot of sentiment about not knowing what to do. In the youth and parent focus groups, there was a lot of consensus on teaching mental health at an earlier age. There were high school students who said they have received no education regarding this, some who had said that they got a little bit in health class, but it's not a primary focus, and that's concerning because like was said before, I believe that education is one of the key components to helping youth cope with their stress and their problems. How am I doing on time? I have no clock in front of me.
About 20 minutes.
Until
20 minutes left.
until 1, so we can talk in a little bit. Okay, cool. So I'm just going to give you a little overview of phase 3 because we're in the planning stages of that. We're actually, we have our protocol into our institutional review board and are waiting for approval. But we are going to survey a large population, general population of youth. We're not just going to be talking to those who have had struggles or mental health problems, but we want to talk to that general group because we know that so many don't get help that they need, or they don't recognize that they need help, or they just don't know where to go. For high school students, we are going to survey up to 6,000 high school students. We're doing it in kind of a unique way, unique for research, that is. We're going to be putting together all school assembly survey events. So all the students will gather in the gymnasium or the auditorium, and we have this presentation we're putting together that uses video content. So this is educational. It introduces them to the technologies. And then we're also going to include some testimonial video in there of real youth talking about their problems. And then we're going to use a polling technology. It's much like Poll Everywhere or the clickers. Has anybody used those in class here? So the students are going to be using a secure Wi-Fi, and we're going to be pushing out the questions to their technology. So they'll all have their smartphones, laptops, or tablets with them. And we're going to be showing the questions on screen. And this is amongst all the video content. They'll answer it using their technology. It comes up and then to us, and then we'll be able to show them some bar graphs and charts in real time. For the college-age students, we're going to be releasing an online survey for those who are ages 18 to 24, and we are starting at IPFW. We're going to be working with the Dean's Office to identify people who are within that age range, and then they will get an invitation via email to participate in our survey. Now, in the high school students, they, their big motivation is getting out of class to come to these events. For the online survey for college students, we are offering an incentive. So I encourage you guys, when you see that, to come through, to please help us out and give us your opinions. One thing that I've learned from the start of this study over and over again is that many people, youth especially, don't know what mental health means. I had asked my new stepson, he is 15, I said, "What's mental health?" And he said, "People with special needs." And whoa. I wanted to have a term that everybody could relate to. So I started asking different people these different things, and I asked the youth in the focus groups, what should we call it? What should we be talking about that everybody can relate to? And stress was what we came up with. So we're going to be framing our mental health discussion around stress and all the different ways that it can affect you, including mentally, how people cope with stress, and then how people learn to cope using technology. And that's where we'll introduce those specific examples. And instead of static pictures like the PowerPoints that we use in the focus groups, that will be video content. So there will be a voiceover description and then a ScreenFlow video showing them how these things work. And we'll ask them their preferences. So I would love to get some discussion going here on what you guys think of our study, any concerns that you have. Yes, please.
Yeah, before you jump into all the substantive questions, first I want to thank you for coming back to your alma mater and sharing your career with us. That's invaluable. So could you repeat your job title? And I'm curious about what percentage of your time is spent on research. And then finally, if you could characterize career opportunities for students with social science background in large health networks like Parkview.
Absolutely. I'd like to start by backing up a little to nursing school because that's where I started making contacts for the position I have now. So I work within Parkview Research Center, and we have these team groups which are focused on different things like oncology and cardiology and things like that. And I'm part of the informatics group. So we look at different ways that technology could be helpful to providers and patients. When I was in nursing school, I had to take an informatics course. And one of the things that we had to do was to produce a health education video about menstruation. And this was going to be used within the classroom of fifth graders, fourth or fifth graders, I believe. And so I started working with my informatics professor, and ultimately, right after I graduated, she called me to ask if I would be interested in being her research assistant on another project separate from this. And so I started working with her while I was working on the floor. So I was a floor nurse on an ortho neurotrauma unit, and I was also a TA still here at IPFW. So I was juggling 3 jobs. I let her know, my mentor and professor, that I was really interested in this area and I wanted to do more. Once I got to Parkview Research Center, the informatics group was still in its infancy stage, and we had opportunity to take different directions. The only thing they had done before was related to cardiology, and we had a discussion with a group of about 6 of us one day, and there was a call for proposals from the Robert Wood Johnson Foundation, and I was able to speak up and say, I think this is an area that we should really look into. Dr. Mira was at the table and fully supported it. He had a nephew who died by the consequences associated with bipolar disorder, and our project just kind of took off from there. One thing that I've also learned is that this is a big area, and there's so many people who are passionate about helping people with mental health issues, even just temporary ones. So we started talking to people in the community and have a very large support, which we picked some people from key organizations and put in our core team. So we have people from our team from Park Center, Bowen Center, Parkview Behavioral Health. We have a trainer in suicide prevention and some other people. So I went away from nursing in a way, but like I said at the beginning, I get to apply what I've learned in nursing to this research that wouldn't have been done otherwise. And it's nice to be able to open up your perspective and have an open mind when you're looking for employment. There's a lot of people who I graduated with that, they had tunnel vision after graduation. I want to work in this hospital, ultimately on this floor, in this area, peds, OB, whatever. And I left my mind really open of the possibilities of what I might be able to do with my degree. Yes, please.
I guess I'm confused as to where nursing comes in. You say you used your experience as a nurse. And I think about these jobs that you guys do with clinical research, and I don't know, I guess as an anthropology person, worked in bioanthropology, I wonder, 1, are they only looking for people with nursing backgrounds? 2, how is it exactly that you're using your nursing background?
We actually only have, our informatics group is composed of 9 people, and only 2 of us are nurses. Most of the people who are in the clinical research are nurses. They're required to have a degree, and they use their nursing skills in a much different way than I do. So they're still seeing patients, they're enrolling patients in studies and taking labs and vitals and things like that. for the purpose of other people's studies. So they're working on research that people from around the nation have let us know about, and they get to work on that part. In informatics, it's an indirect way of how I'm able to use my nursing skills. One of the biggest pieces are those critical thinking skills that I learned in nursing, and be able to see people as individuals. I have heard a lot and learned a lot of people that generalize. All teens want to do this. All college students feel that way. We don't want, they don't want to talk to a person face to face, and things like that. And I'm able to apply my nursing skills to say, no, we need to look at these people as individuals. Not everybody's going to react the same way. They're not going to be using the resources in the same way. So we have to find other ways to care for them. And I think that's a large part of our study. For those people who wouldn't get help, or they're not able to get professional help, are there other ways for them to do that? And just I actually look at the 6,000 high school students as my patients. We've heard from one recently in a school that we're trying to go in for our survey that just within the last couple of weeks lost a student to suicide. And all the schools that we talked to, they confirm what that Lutheran Foundation survey had said. And yeah, we don't know what to do. Indiana, from what I've looked into so far, doesn't have state mandated protocols in place for students with mental health needs in high schools, which is a scary thing. I had one school administrator ask me, how many times does a student have to say they're suicidal before we're supposed to do something? Yes, please.
So I have a lot of questions, but related to that sort of line of thought, you gave lots of examples of resources that people who are suffering from suicidal thoughts or depression can use in order to try to help themselves or to get help. Are there similar resources that perhaps address that gap in the education? Like, are there apps or sources that we can go to and say, hi, I'd like to become more educated on what to do if my friends have mental health issues?
There are. The Mental Health Association is the main one, I think, that I like. I think that they put their educational materials in a very understandable way, and they divide them out into for students, for back to college, and for parents and loved ones. The information's everywhere. What's hard for a lot of people to understand is or to recognize, is the quality of those sites and resources. What can you believe? I fear that a lot of youth, their go-to is to trust what they read on the internet. Yes, please.
So Parkview is doing a lot with the community, it sounds like.
Mm-hmm.
Have you heard of any other hospitals or other research centers doing this in Indiana, or is this like the first time?
I don't know of anybody else who's doing a study quite like ours to actually ask a general population their preferences. There's in Indiana, I know there's research being done in the Indianapolis area specific to suicide. I know right now they are focused on the population of men between the ages of 40 and 60 or something like that, which is now a high-risk group for suicide. So it's not exactly targeted at this group. But we are hearing we have people coming out of the woodwork, it seems like, and it's so exciting and empowering to hear from these people. But people like from Georgia Tech have contacted us. Florida, and they're telling us what they're doing, and they overlap somewhat, but nobody's doing exactly anything like we're doing. So I'm very hopeful that whatever information we get will be useful to a very large population, and we'll be looking to go to conferences and publish in journals our work, hopefully quickly, so it can be used.
Now, is this a study that you're planning on doing like semi-annually so that the data can stay somewhat up to date?
We're not planning that at this point. Our hopes are that we get some quality information that might guide us to the next point in this research. So looking into a more specific area instead of this big, wide umbrella of telemental health. We don't know exactly what that will be yet, but we have a lot of opportunities in the works. Yes?
The information sort of aggregated and you probably with cohorts, and did you divide up what types of students you were looking at, either urban, rural, ethnic backgrounds, class backgrounds, and did you see any discrepancies?
Now, we did not do that for the focus groups. We actually were trying to recruit a very wide variety of people, and we did that somewhat, but it was too small of a group to get any sort of thing like you're talking about. That is what we're going to be doing with the youth survey online and in the youth survey events. So we'll ask them some general demographic information, but then we're going to be asking them a couple of the same questions from the Urbis. So we'll be able to compare our population with that population in Indiana and the country for those Urbis questions. We're going to be asking a couple screener questions that may indicate a need for professional mental health help. So in that way, we're going to be able to tie how they answer to these questions and how it ties back to each of these different groups. So we'll be looking at all angles of it. Yes.
Thank you.
Thank you guys so much.